Hi, I'm Dr. Natesh, Senior Consultant Orthopedic Surgeon and Professor of Orthopedics, Virinchi Hospitals, Banjara Hills. So today I'm going to speak about osteoporosis. Osteoporosis is a very uh, big pandemic, and it is a very silent disease. Silent disease in the sense that there won't be any symptom of the disease until the patient sustains an osteoporotic fracture. We would have heard that many of our known people or friends, relatives, somebody having especially old age people above 65 or 70 years falling and sustaining a fracture. And often many times we hear that they don't even really know the reason why they fell down. So in such cases the reason usually would be osteoporosis. In osteoporosis there will be a fracture of the hip joint. They will suddenly lose balance and then they will fall down. It's not the other way around, like they will fall down and then they sustain a fracture, which is commonly thought of. So when the patient sustains an osteoporotic fracture, the treatment will be usually joint replacement surgery, especially in old age patients. But to prevent osteoporotic fractures, the patient should have a periodical DEXA scan, that is dual energy X-ray absorptiometry, or evaluation of vitamin D3 levels in the body. And because of these recent lifestyle changes, nowadays many people are not able to get sufficient sunlight and sufficient physical exercise also. That is causing secondarily weakening of the bones, osteoporosis, and especially at old age the patients are having a lot of bone related issues. And because they don't have any symptoms pertaining to that particular problem, the patients tend to ignore the problem a lot of condition in a lot of occasions, and then they suddenly sustain fractures. So my suggestion would be to get a periodical checkup at least once in 4 or 5 years. Get a DEXA scan done, and include that in your regular health package. And once you get that DEXA scan done, based on that we will be knowing your risk of sustaining a fracture as well. By using an algorithm, we can get a frac score, and based on that, if your risk of sustaining a fracture, osteoporotic fracture, is very high, then we will be treating you accordingly, and we can prevent or avert a fracture that would have happened if we don't treat the osteoporosis that is already going on in your body. So please include DEXA scan in your routine health checkups. Thank you.